For those of you who have cancer, or those of you who are worried about cancer recurrence, or avoiding cancer, the most important thing we know now about cancer is that cancer cells appear in our body every day. And every day our immune system takes care of them by screening, filtering, and removing cancer and abnormal cells from the body. It's when this system is compromised that a cancer cell can go from 1 cancer cell to 2 cancer cell to 4 to 6 to 8. And as a matter of fact, the literature is showing that cancer can sometimes be growing for a decade, 10 years or more in the body before it's ever found. And if in that 10 years the immune system manages to recover, the immune system will catch it and reverse the cancer. For those with cancer who have had either radiation or chemotherapy or surgery, the looming question has to be that now that the cancer is gone, what about the underlying imbalances that allowed the cancer cells to grow in the first place? That's where a restorative approach comes in. The 5 areas that are addressed, the first area that you want to make sure is optimized is hormonal. The hormones that are most critically linked to cancer by science, one of them is melatonin. We know that melatonin levels plummet to almost 10% by the age of 40. And melatonin is the hormone that is responsible for natural killer cell activation, and natural killer cells are the cells that get rid of abnormal cancer cells. The second hormone to pay attention to is progesterone. In women, progesterone is the hormone that stops the division of breast cells and uterine cells and ovarian cells. Progesterone levels drop to almost 0 by the beginning of the 40s. Hence, the cells divide much more actively. And studies have shown that women with progesterone deficiencies have a 5-fold increase in breast cancer and a 10-fold increase in all cancers because of the division of cells. The second area to pay attention to is nutrients. For example, vitamin D levels of 30 to 100 are considered to be normal. But vitamin D levels above the 70 mark are associated with a 50% reduction in cancers and cancer recurrence. Other nutrients that are critical are iodine and zinc and antioxidants in the body. We know that vitamin C is critically important. The most important thing you can do for yourself to protect yourself from a recurrent cancer or a new cancer is to measure the levels of intracellular nutrients and optimize them above the 75th percentile. And these days, there's excellent tests you can use to measure both your hormones and your nutrients. The third area is going to be the toxicities. We know that these days we're exposed to pesticides and electromagnetic fields and heavy metals and all kinds of things through the air, the water, the food supply, genetically modified organisms. And the most important thing we can do in this area is reduce our exposure by becoming knowledgeable. But the second important thing is to make sure that the 6 areas of the body that eliminate toxins are optimized to reduce those toxins in the body and eliminate them. Those include the bowel, the liver, the gallbladder, the skin, the lymphatics, and the kidney. What we've recognized over time is that since 70% of our immune system lies in the bowel, in the gut, that the inflammatory state of the gut is critically responsible for how your immune system works. So that is an area that we pay a lot of attention to when trying to protect people from cancers. The fourth area is going to be the state of the mind. The subconscious and the conscious mind control our immune system. Many studies have now shown that the thoughts we have directly control neurotransmitters that affect the immune cells in every organ of the body. The fifth area is the state of the body itself. The oxygenation that's carried by blood vessels. If the blood vessels are in poor repair, the oxygenation is in a poor state. If we're in more pain in the body, then we're depleting ourselves from critical hormones and nutrients that protect us from cancers. So when we're looking to address an existing cancer, prevent a recurrent cancer, or prevent the first incidence of a cancer, the first thing to do is to make sure that we optimize these 5 areas and correct potential underlying causes of deficiency in the immune system which allow cancer to grow in the first place.